Very good evening, all medicos listening to us. Very good evening. We are having the privilege to have Dr. Balachandra with us, rank 18 INICET. Beta, we congrats you for such awesome achievement.
Thank you, sir. Thank you so much.
And
I'm
how
Dr.
you are feeling after getting this double-digit rank of 18?
I feel very happy and very relieved, and I'm really very happy.
Very happy, yeah. So now I will be using this platform, beta, just to guide all the juniors, all the medicos across the country. Okay, what should be the strategy? Like as a fresher, you crack this rank of 18. So what should be the strategy in upcoming next spell of few months or few years for all the first year, second year students? So let us start with the conceptual. Like you got rank 18. So what was the role of conceptual learning, conceptual class notes in your success journey, beta?
As far as the current pattern of exams are concerned, concepts are very important. The most important thing is concepts. Even once you master concepts, it's actually lifelong, and we have long-term memory of those concepts. Factual questions you can read at any time, but concepts are very important. And if you really understand properly one concept, you can answer any question based on it. So concepts will definitely, like even if they give a new MCQ based on it, you will definitely be able to crack it. So concepts are very important, especially for the preclinical subjects. So the faster you can conceptualize the first year subjects, it will make your future learning also very easy.
That's very true. That's very true, beta. And I again proudly share this success of 18 with every medico across the country. And I'll be using next couple of minutes to just make a like master plan for the next upcoming years. Like when you were in the first, like all the students of the first year listening to you, what should be the strategy in the first year, beta? Once you enter in a medical college with no orientation, how we have to perform in the medical college. So what is the perfect advice for the first year students?
Best advice would be start reading as early as possible in first year. You need not prepare from a PG point of view, entrance point of view, but try to read as much as possible so that it will form a base. The things which you read in first year, if you read it in detail, you will never forget it for the next 4 years. And even if you don't understand some hard concepts in physiology or something, you don't need to fret about it. Understand and conceptualize how much you can. Once you come into the second and third year, and as you learn more and more medicine, you will automatically understand those concepts. So as much as possible, try to get your concepts clear as much as possible, and try to don't study all the 3 subjects in a separate way. Like physiology and anatomy, like especially in CNS part, will be a lot of integration. So read them together so that when you get an overall view of the entire topic, instead of just reading one segment as separate parts, if you read as a complete integrated one single concept, then it will be much more easier for you to remember.
What I'm getting from your words, very nice. You should start learning in an integrated way from the first year itself. Like you are learning CNS, so it is better you read from physio and anatomy and integrate it. Very nice, very. So, after the first year, when you enter in the second year, what was the role of second year in your final year learning concepts of medicine, surgery? How they depends on the second year subjects.
Second year subjects, they hold a very important role, because the more you can study in the second year will actually help you in the future. Like most of the concepts in medicine will be focused mainly on pathology and pharmacology. So those are 2 subjects which you need to, at least, even if you cannot master both the subjects, at least one subject you should be very clear. Like either it's pathology or pharmacology, you have to be as thorough as possible and get to know as many information, so that when you read in the final year subjects, you at least have a base, so you can build up on that. You need not learn anything new. Like you need not take any disease as a new topic. You already know some part of the pathology of it.
Very true, beta. Now, like pattern is changing from the one-liner to your clinical vignettes, integrated learning. So where you find like you appeared for INICET with such an awesome rank of 18. Now, I want you should tell us what is the importance in the new clinical vignette pattern, the role of second year subjects, pathomicropharma.
Second year subjects also will play a role. They can give you a case history and with a pathology question. So when you are in second year, you may not be able to solve clinical vignettes, but if you have your pathology and pharmacology strong, when you come to final year and once you get practiced, the integration will automatically come to you. So you need not fret because you cannot understand the vignettes in second year. Once you come to final year or third year, once you come to see the cases, you will actually get to know more. So as far as possible, when you are studying second year, try to read the second year subjects as good as possible.
It's possible. So now, like after doing very conceptual learning in the first year, second year, you were in the final year. So, any tips to crack the final year subjects like medicine, surgery, which is a big phobia for everyone?
The thing about medicine, the final especially medicine, surgery, and OG. OG is comparatively smaller and more defined, and so you can easily complete it. The surgery, I studied from Bailey, and most of the entrance questions are also framed from Bailey. So, but even if you don't read Bailey, if you follow any coaching center, they'll most of the coaching centers base their on standard textbooks. So, even if you don't read Bailey, it's not enough. It's not were not a disadvantage because you can still clear those concepts. Medicine, most of my medicine knowledge was actually based on the pathology and pharmacology which I had already learned. So if you are well versed in pathology and pharmacology, medicine will be very easy, and you can use whatever material and whatever platform. But just see that you are able to get as much as medicine in the final year, because once you start preparing internship, you cannot read medicine entirely. I haven't read medicine during my preparation once completely because medicine is so vast. So the more you read it during final year and the more basement you lay down in final year, it will be actually helpful when you prepare, because medicine is very vast and limitless boundaries, and so you need so as much as possible try to cover in final year. So without wasting any time, try to cover as much as possible with medicine, because the other subjects you can cover later even during your internship, but medicine, if you cover a lot in final year, then it will be very easy while preparations.
That's very true words you are telling. K, if we want to conquer the medicine surgery, we should go with the standard textbook followed by your basic pathopharma concept should be very strong. Then I feel K, like medicine surgery will be on the easy side. Easy side. Yeah, very true. Now, after learning this conceptual learning of first year, second year, final year, what was the role of like MCQs? Like, what should be the approach to the MCQs in the second year? What should be the approach in the final year? And what should be the approach 1 month before your examination?
Uh, I did not start practicing MCQs in the during my MBBS. I started only after internship, but I went to a lot of quizzes and participated in a lot of competitions. So that with that I got that MCQ practice. And with the upcoming next exams, you have to start preparing MCQs earlier. And MCQs initially I used to make a lot of silly mistakes like those all of the following except. I used to like skip those questions. So there you have to get a lot of practice in MCQs. It doesn't matter how many MCQs you do. You can just keep on doing as much as possible, and try to focus on those which you will miss, like the except, the all other than. Then certain things like we'll miss. If there's a very huge case, long case, then we'll miss out whether it is an oral drug which was given or a parenteral drug, whether it was a male or a female, or whether it's pregnant or non-pregnant. We'll miss out those. So those type of silly mistakes you should avoid as much as possible, because that will make a lot of difference.
That's you should focus on the keywords, okay, how to crack these clinical vignettes. Very nice, beta. Now, after doing like exhaustive conceptual learning and these ample practice of MCQs in an internship, beta, you attended our AIIMS and COVID capsule. So, what was the role of AIIMS and COVID capsule in your success journey of this INICT?
The COVID AIIMS capsule was very useful, especially it was focused on the high yield topics of INICT, the special topics which they focus upon, and the physiology videos, the pediatrics, the latest protocol guidelines, and the COVID protocols. The recently uploaded COVID protocol video, that was very useful, because the entire COVID, both the microbiology, the clinical aspects, and the preventive medicine aspects were covered very nicely. And like a lot of questions were asked this year on COVID, almost 5 to 6 questions were asked. So it was very useful.
So all those 5 to 6 MCQs which were there in the INICT, they were well covered in the COVID capsule, beta. It was like after COVID capsule, you were feeling comfortable with the latest new updates, MCQs of COVID.
Yes.
And what was your approach? Like we have given in an integrated way, we have given all the topics in an integrated manner in your AIIMS and COVID capsule. So how those integrated sessions played the important role, beta?
The integrated sessions and the integrated MCQs, like every subject has its own integrated question bank. So that will be very useful. Like if we don't feel like reading any subject, or we are like a little less motivated, if you go through those MCQs, like it will be like studying 1 or 2 subjects together. And even when you study, you can study like an integrated manner. For example, when you read about surfactants or something else in physiology or biochemistry, you can read about the clinical aspects in pediatrics. And if you see one question like that, you can revise 2 independent subjects together. So integrated MCQs is very useful, and it also increases your thinking capacity and the time management and all is because they are long questions, and you will get adequate practice in cracking those long questions.
Questions. So now better like in the AIIMS and COVID capsule, along with that, after followed, you must have attended our DVT, where we, for the first time, we came with the innovative concept of integrated learning. So those 7 days where we have compiled all the 19 subjects in an integrated manner, what was the role of DVT session in your success?
DVT was also very useful because there were system-wise classes, and like it was almost like covering most of the important topics for NEET as well as INICET, especially the respiratory medicine part, because I was a little weak in respiratory medicine, especially the physiology part. So integrating that with the clinical aspects was very useful, and it was like a very good revision because that time I was in the revision phase. So it was a very good useful revision tool for both NEET pattern and INICET pattern questions.
I see. Next, the pattern is getting changed from the one-liner to the integrated MCQs clinical vignette. So, any strategy like how we should attempt the clinical vignette, how we should go to the lengthy MCQs where most students have the phobia?
If it's a lengthy question, your main thing is you have to focus on. You should not get distracted by too many details. So you have to practice so many MCQs such that you don't get distracted by the unnecessary terms. But at the same time, you should be able to pick up the key concepts, the keywords in the question, especially those the age based, for example, whether it's pregnant, non-pregnant, nulliparous, multiparous, or whether they are opting for conservative or surgery. Then the last line of the question is important, whether they're asking what is true, what is false. Then look at the options. The options and the last line play more important, but you should not just neglect the entire case because there will be some keywords which are important. But so you should get that practice of doing every MCQ at a faster speed than usual. So clinical vignettes will take more time. So you have to practice more and more questions so that you get that speed in cracking those questions. But don't ignore any line. Even if you are just reading once, read it completely so that you analyze the question properly, so that you don't miss out any of those keywords which are important.
Like you use the word time management and you use UK, we should complete this clinical vignette on time. What was your time management in your INICT, beta, last INICT?
Usually I usually finish the exam, the mock test half an hour before. So this exam I started from the first. I did not mark anything for a review because the review questions would not be counted. So I finished at a go. I finished around 160 questions, and there was 45 minutes left. And after which I went through the other 36 questions which I had left. And the 36 questions I took a guess and educated guess with about 30 questions, and I answered. And then I realized that this was the number of moderate questions was lesser. So as I wanted to attempt more and give better chance, so I attended around 193, and again towards the end I answered the rest, another 5 questions, and I answered 198 questions. And the thing is, depending upon the difficulty level of the question paper, you should manage your time, and don't attend all the questions in one straight go. Just don't shuffle between too many questions because you won't have time. So go with your first guess. Usually that will be what is correct, and don't overthink on at least one MCQ alone, because each MCQ, whether it's hard or easy, will carry the same 1 mark. So give you equal time to all the MCQs, and if you have time at the end, go through the questions again. Otherwise, go by your gut feeling and go by the first option which you think is correct.
So for getting such an awesome rank, I feel we should be very aggressive. And 193 you attempted in the last INSC. That's great. And you highlight the word difficulty level. So how you compare the difficulty level of CBT, like you appeared for CBT and then you went for INICT? How we compare these two things, Beta?
The INICT CBT was very balanced paper, and it included all the pattern type of questions, and it was very balanced. Like it was there were not too difficult questions and too easy questions. So it was almost matched the balance level of the INICT exam, both the CBT and the main exam. And in fact, one of the questions actually came in the exam, like the question on psychiatry, on burnout of doctors, actually came on the exam as well. So the CBT was very balanced. Like there were not too many difficult questions, but at the same time, each question made us think a lot, and it was very nice experience. The CBT, the INICT CBT.
And in this success journey, Beta, last again, we are very proud to share a success story of our Damsonian with rank 18 in last INICT examination. But what was the role of DAMS family in this success? Like how the faculties, apart from teaching you, what other role they played in the last 1 year?
DAMS, mostly I used to do all the test series, and used to, after finishing the test series, I used to watch all the video discussions. The video discussions are also very useful. Like certain questions, I thought I answered correctly, but then I got them wrong. So there was some conceptual mistake in my side. So I used to go through the videos and find out what was actually wrong with me. So what concepts I had got wrong, because some questions I thought I answered correctly, but actually I ended up writing with them wrong answers. So I went through all the video solutions of all the subjects, and I had a separate notebook for all the test and discussion solutions. And before the INICT, I had some 3 notebooks of the test discussion video solutions. So though all those 3 notebooks I revised the 3 days before the INICT, and that proved very useful. And because those were the parts where you make mistakes, so you should not repeat them in the next exam. So those notes were very useful for me.
That's great, beta. So, beta, any special message like I want all these students who couldn't perform well in the last INICT and they are now working for the next NEET examination. Any special message for those students?
The NEET aspirants, don't lose hope, and always focus on the previous year topics, just not the questions. All the topics, because lot of repeats were asked in this year's INICT. So NEET, even if they are not repeats, it is better to go to the exam more prepared, so that you are less shocked by the questions. So as much as possible, try to go to the previous repeats, the previous year topics, be thorough with them. As how many times you want, you can revise them, and see that all the errors which you made in the GTs are not repeated, like and all the forgettables which you whenever you revise, write down the forgettable topics in each subject separately, so that you can revise those on the day before the exam. Because forgettables they have very high chance of getting a mistake in those topics. So each subject, note down the forgettable topics and then revise them before the exam.
Like you're highlighting the value of revision before coming the NEET examination. So, beta, like before INICT, how many times you revise your 19 subjects?
The INICT previous year topics, I revised before this exam. I revised almost 3 times, and before the exam, the last 4 to 5 days, I revised all the important topics for the INICT, like the biostatistics in community medicine, the anatomy topics, and the protocols, the criteria. All that I revised in the last 3 days. So the more revision I had, you are better, because INICT there are certain selected topics which they keep asking. So those topics should be well versed and know each and every part of the topic. So the last 4 days, devote yourself to the most important topics of them all, which you keep forgetting. So that will help you a lot, because you're reading it very close to the exam.
So, like when you were revising all the topics, you updated, you revised 3 times. So any strategy you want to share with now you are getting rank 18, you are going to get your dream college, dream branch. So I feel you can share with everyone. Any strategy for the revision part?
Revision part, initially I was also very I started revising last October. Initially I did not have a strategy. Then I realized that make short-term strategies as far as possible. Don't prepare for make a strategy for 3 months. Just make a strategy for one week. Every week prepare new strategy, and have short-term targets, and try to focus on where you're going wrong. So the more you focus on those areas, the better your scores will also start improving, and you'll also get that confidence when previously weaker subject will start becoming stronger once you focus on the weak areas, and give more and more tests as far as possible. Even if you're not able to give tests, give MCQs. Practice more of MCQs, and concentrate on the previous year topics, the repeated ones, and the areas which you are weak in. So that will help a lot.
So last point I'm asking you, whether out of 19 subjects, I'm going for next NEET examination. Which subject I should give more priority? Which subjects I should give more priority?
You have to give more importance to the final year subjects, the main subjects like medicine, surgery, and OG. Especially OG, because you have it is not as vast as medicine. It's not a very short subject as well, and you will have definitely a lot of questions on OG. And for medicine and surgery you have to read it completely, because a lot of questions. For medicine, even if you don't read entire medicine, ensure that your pathology, pharmacology, and microbiology are as strong as possible, so that even if you don't read medicine completely, these subjects will always give you a hand in the integrated questions.
That's great, Beta. That's great. And thanks a lot. We again congrats you, your family for such an awesome achievement of rank 18. And we wish you, okay, you will be getting a dream branch and you will excel in the upcoming